Executive Marc Elrich, County Health Officer Dr. Travis Gales, and the Director of the Office of Emergency Management and Homeland Security, Dr. Earl Stoddard. We'll start things off today with the County Executive.
So I'll give you all a little update on where we stand. Our residents are doing an amazing job of cooperating and working with us so that we can bring down the numbers of the virus. We're not out of the woods yet. However, I don't even think we're actually imminently out of the woods, but we're doing as good a job as I think we can do to contain the spread of the virus. This morning, the state has 414 positive cases out of almost 14,000 tests, and Montgomery County has 53 positive results out of about 2,330 tests. And that's the most tests of any jurisdiction, despite the fact that we've had to temporarily pull back some of our testing. However, county-issued COVID-19 tests are back up and running. Clinics tomorrow and Friday, no appointment will be needed this week, so people can start coming back to the clinics. You can see on the website what's open. We still encourage symptomatic folks to make an appointment. It just simplifies being able to separate out symptomatic from asymptomatic patients, and making the appointment keeps people from showing up too close together. So we're trying to encourage that. Plumgar Rec Center is good for Thursday the 20th, and the White Oak Rec Center will be good on Friday the 21st. You can also order the tests by mail to do at home. Non-public schools, we want to remind people that the law is that if any school has positive cases, they should contact the county's contact tracing team at 240-777-1755. We've only had about 4 non-public school plans come in, I think, so far. Earl can correct me, and I think only half of them actually came from the schools themselves. The Association of Independent Schools has also requested feedback on their plans when they present them. They will get feedback. We've still not received any guidance from the state regarding non-public schools. And I want to emphasize, when the governor said that they didn't want the county acting or regulating this on our own, they said that schools needed to follow CDC guidance and the state guidance. There is no state guidance, which, as you can imagine, will make it very difficult for us to evaluate plans in light of state guidance if the state doesn't provide the guidance. We've heard various talking points, for lack of a nicer or worse word, that these things are in front of the governor and they're waiting for approval, but we really need the guidance so we can evaluate the school plans. I will also emphasize that we continue to feel strongly it is not safe to open any school right now, and we recommend non-public schools which have not made the decision yet to open to please not open. That's really important for us. On elections, we continue to make progress with the state on the elections. I guess the good news yesterday at the federal level was that the postmaster is not going to sabotage the mail system completely before the election, and has agreed that they will hold back any of the more severe things that would impact mail service until after the election. The Montgomery County Board of Elections they're starting a vote plan, or encouraging residents to have a vote plan, get registered to vote, or ensuring your voter registration is up to date. The deadline to register to vote is October 13th. Due to COVID-19, the board recommends voting by mail. We are strongly recommending voting by mail. A mail-in ballot can be requested by texting VBM to 777 or visiting the Board of Elections website at 777vote.org. These are really important to get these by mail ballots in. If we have by mail ballots, they can be processed with the rest of the ballots. If it's an internet ballot, we will not be able. We will not be able to quickly process them. It's a much longer process. So we need as many in mail as possible. And there will be drop boxes at various places around the county, the voting sites, where you'll be able to just come in and drop your mail-in ballot directly into a drop box. You can fill out the application that should arrive by mail in early September. For every registered voter, you will be getting this. This is a state action. Fill
Mr.
out
Elrich.
the application and they will send you a ballot.
Mr. Elrich, it's Julie.
Again, it's important to, when you're requesting a mail-in ballot, check the box for choose by mail, not by internet.
Carmen, can we
yeah.
Oh, you can hear me now?
So those
we've lost you, Mr. Elrich.
On the ballot. Yes.
I've got no picture
So
for
I'll
you.
Stop there.
Your audio is dropping out. Maybe log out and log back in, and we'll keep the media briefing going and have Dr. Gales pick it up from here. But it might be best if you log out and log back in. Dr. Gales, you want to go ahead?
Sure. Good afternoon, everyone, and happy Wednesday. So I want to give a couple of updates and highlights from the county executive's remarks. As he mentioned, with the testing apparatus, we've been working since last week to explore and leverage our current partnerships with labs, as well as explore new partnerships in terms of looking at new companies as well as new modalities, particularly around self-collection, because self-collection testing has allowed us to do high throughput testing, to test a high volume of folks within a smaller period of time and increase access for testing to individuals, particularly those who are asymptomatic. And so the team has worked tirelessly to come up with a new strategy that builds upon, I see there's someone having issues with my feed. Can you hear me okay? Can you hear me okay? Okay. So building upon the existing infrastructure that we put into place over the last several months to expand testing. And so as he mentioned, we will be having opening back up testing again. Well, symptomatic individuals have been able to test throughout without any interruption of service. But starting again on tomorrow, we will have testing at the Germantown site in the morning. And then we will have testing at the Plumgar Rec Center in the afternoon. Again, this is walk up, no appointments needed. And then on Friday, we will have testing all day at the White Oak Recreation Center. This information is on our county website. Now, we are recommending and encouraging individuals who are symptomatic to schedule an appointment to make sure that we've have the necessary procedures and precautions in place. But as of now, walk-ups are accepted. Now, we will continue to work for the larger rollout of our schedule. We'll be announcing that on Friday and providing more details for next week's schedule. Additional point I want to highlight is that as of over the weekend, the state is no longer formally supporting the nursing homes to provide testing for their staff and residents. And we will be continuing to work with the nursing homes to be able to support them in those efforts moving forward. Another point I want to highlight is it relates to the testing data and the numbers. As the county executive mentioned in his comments, that today we did see 414 cases, I believe, across the state, but it was out of 13, just shy of 14,000 tests. And what we've seen across the country over the last several days is cases have decreased, but there's a concerning trend that testing is down significantly across the board. And so when we look at a day like today, there were over, I think it's 13,890 tests that are resulted. We want to, and that's in comparison to yesterday where we had over 28,000 tests resulted. So we're going to continue to watch and monitor to see if that is an ongoing trend, if we are seeing continued decreases in the amount of testing that's provided, not just for us in our jurisdiction, but across the board, because certainly we want to see testing numbers higher as the case counts come down. Now, the third thing I want to just emphasize is, and turn the floor over for questions, is that even in the cases that we're seeing pop up, we are seeing continued trends of higher percentage of cases in younger folks. As we talked about last week, we now see somewhere between 16 and 18% of the new cases in Montgomery County that are ages 0 to 19. And that's consistent with the trend that we've seen in the state over the last month. And this is on top of national information that suggests as more kids are being tested, we actually are catching more cases in the 0 to 19-year-old age group, as well as the 20 to 29-year-old age group. So just want to make sure you're aware of that trend happening as well. We continue to monitor all of these different data points to drive the decisions that we make from a public health, a clinical, and a scientific perspective. I'll stop there, but happy to answer any questions that you all may have.
Let's get to Dr. Stoddard first, and then we will open up the floor for all reporter questions.
I only have a couple updates this week. Thank you for being here. First off, on the enforcement education perspective with our businesses, we were out this weekend again. We issued no citations, no closures this past weekend. We did, continue to see some minor issues, but obviously this was an overall. We're getting good compliance from our businesses, and we got really good compliance this past weekend. State hotline to report physical distancing or face covering, violations. The county had 9 of the 94 statewide complaints for that, so less than 10%. And we'll obviously be following up on those over the course of the week. The hotline just opened up. That was the first few days. We got the report on Monday, and that's sort of where we sit. For food security, I do want to give a couple updates here because I think we haven't talked about this in a little while. We do a lot in the food security realm, and we just had a grant that was issued for our food providers to expand their capacity. There were 28 awardees receiving a little over $1.1 million. The goal of that grant was, so we had one grant previously that allowed additional providers to come online. This grant was for existing providers to expand their capacity out and be able to distribute more food through acquisition of things like additional freezer trucks and other things like that. We also have a farm to food bank program that we've been working with, and we infused some additional dollars into that will take food that's being produced in Montgomery County and get those out to the food banks so that we can expand overall those efforts. Continue to work with MCPS to see what we can do in terms of activities. I know we've previously talked about childcare. That's something we continue to talk about as well. But this week we also really started having more constructive conversations around things like SATs, and what we may do this year that's different than previous years is that there may be opportunities where some of those SAT offerings are done out in places other than MCPS facilities. We're discussing the use of county facilities like libraries or rec centers to potentially allow for more spacing out of students. Many of those SAT opportunities were canceled in the spring. We'd like to see that we can do some in the fall, and we're working with MCPS to do that. In addition, I know that they're working on some programming, particularly around special education students and ESOL students, to allow them to have some access to buildings in very small numbers to do some hands-on work, because those students obviously need even more, direct hands-on interaction than other students do. So we're trying to accommodate that need as well, and so more to come on that. That's all I have this week, and I think we'll open up to questions.
Thank you very much. It looks like our first 3 reporter questions involve non-public schools. We begin with Chris Gordon with Channel 4 with questions for the county executive and Dr. Gales. Go ahead, Chris.
Thank you. Is the county executive back with us?
Yes.
I think I am.
Oh, you think you are? Okay. I'm following up on your comments about non-public schools. There's a a tweet that says, hearing the Bullis School in Potomac has shut its building for 2 days to sanitize after several staffers have tested positive. Students are supposed to be back in those buildings in 2 weeks. Why? All capitalized question mark, exclamation point. Are you aware of that? Are you concerned by that? I have not been able to confirm it with Bullis School, except to stop by and see their front gate is closed and there's a security guard and there's no one on campus. And supposedly they have been sanitizing the past 2 days. What is your reaction to this? Has Bullis School contacted the county? And if not, is that a concern?
As of earlier this morning, they had not contacted the county that any of us know of. And is it a concern? Yeah, if they're doing their own contact tracing instead of contacting the county about contact tracing, that's a real concern. Am I surprised? I mean, you can't control where your faculty and staff or anybody has been or will be during the time that schools are open. And so am I surprised that somebody might show up at school with COVID? Absolutely not.
Is there a way to require non-public schools to prove that they're in compliance with state and federal CDC guidelines?
So
The governor, yeah, go ahead.
I want to add to the county executive's comments about it. So we were made aware of it, and we are conducting an investigation to find out more information in terms of, to confirm the reports that there are cases there. Our staff had not been alerted as of this morning by the school, and so we were made aware of a social media conversation around it, and so we are looking into it to provide more information. Once we receive more information about relevant cases, then we will be able to provide the necessary guidance to the school in terms of next steps that they would need to take, particularly in terms of what, identifying individuals who would need to be quarantined or isolated, and the time period and time frame within which they would need to take further action. Unfortunately, we don't have any more information at this time, but the team is actively investigating, and hopefully we'll be able to release more information in the near future.
And to your second part of your question, Chris, there is no state guidance to follow. So there are vague CDC guidelines, and then the state promised guidelines. I mean, this is the governor said this directly, his people said this directly, that they wanted us to follow CDC and state guidelines. We are 2 weeks past the time they said that. There's still no guidelines. We would love to have guidelines because, without the guidelines, anything we do will be our own opinion, and we can't do that.
Ike with Channel 5 also had questions about the same topic. Go ahead, Ike.
For Dr. Gales and whoever may be able to respond to this question, I just have a little timeline I want to go over. Around August 1st, Dr. Gales, you came out and said private and religious schools, they're going to have to remain closed until October 1st because it's just not safe. Governor Hogan came out over that weekend, and then on Monday, on August 3rd, he overrode that decision for the entire county and says that each private and religious school can make their own decision. That decision that you guys made was rescinded. Now, on August 14th, a few days ago, we asked you again about non-public schools, if they can reopen safely. Have you had any conversations with them? And then Dr. Gales, you said that we're currently in litigation. I have a couple questions. Since Governor Hogan rescinded that order to have all private and religious schools go to digital learning until October 1st, what is that specific litigation that you're talking about that's preventing you from actually discussing this with us?
Well, there's a lawsuit in place if you Google it, but I and the county are being sued for the order that we put into place. That lawsuit has not been dismissed, and it is still active as of today, right now. And so because of that, I'm not at liberty to discuss in more detail to answer some of the questions that you may have. It is still an active lawsuit that is in place.
So even though things were rescinded, those parents and individuals who came through with those lawsuits, they're still going forward with it, even though that order was rescinded?
As at this time right now, yes.
And also the Archdiocese of Washington, they just came out and they said that they have plans to reopen all 60 some odd of their schools. As you know, their schools, they're allowed to create their own, not create their own, but create their own plans for reopening. And an overwhelming majority of them, they're doing distance learning, but some of them are doing hybrid, and some of them are even doing in-person instruction. A lot of those schools are in Montgomery County. Have any of those schools contacted you or anybody in the county for guidelines for reopening? I know they said that they're following the Centers for Disease Control, among other things. But, you said yourself, the state hasn't really given you guys any specific guidelines. Well, have these private and religious schools come to you, said, hey, listen, this is our plan. What do you guys think about that? Has there any been of those conversations?
So to that question, as Dr. Stoddard mentioned, I think to date we have had maybe 15 inquiries to have conversations, but I think to date we've only received 4 actual plans to review, physical plans to review. And he can correct that if I'm not accurate, but that is my understanding. We did have a general conversation with representatives from the Association of Independent Schools to hear some of their ideas and their thoughts. But beyond that, there have not been any further conversations. And to emphasize and reiterate, not emphasize, but to reiterate the point that the county executive mentioned is that, yes, there was discussion about the state providing guidelines from the first week of August based upon your time frame. We've not received those to date. And so as a result, we're stuck in a little bit of limbo in terms of being able to review plans, apparently, review them by the state's guidelines, where we don't actually have any guidelines to reference and to provide that further information. And it's important, as the county executive mentioned, is due to the rules that you mentioned in terms of the executive orders and memos that did change the way historically health departments have provided guidance in that space. And so in this space of new policies and the absence of guidelines, it has impacted our ability to be able to provide that direct guidance and follow through for these particular institutions.
Thank you both. Kate Ryan with WTOP is up next with school questions as well.
Thank you. I had a question that kind of piggybacks on what Chris had. I've heard similar concerns about a different private school. I'm not going to name it because I can't confirm it yet. That there are as many as 20 to 29 cases out of one school. Are there mechanisms for reporting to the public if there is a COVID outbreak at private schools and at the public schools, where Montgomery County Public Schools will be, I don't know what the proper word to use for it, but hosting or allowing daycare programs, all-day daycare programs through programs like Bar T? Will that be reported out to the public if there are outbreaks? And what kind of protocols are in place for that?
So as with any situation, if there's a positive case that comes up, there are expectations and requirements in terms of reporting. So there's 2 mechanisms within which we find out from the local health department in terms of that information. So the first one is if there is an outbreak actually, quite frankly, is defined as 1 case in many of these settings. So if there are cases reported, in many instances, the expectation is that the entity would contact the local health department and say, hey, we have cases here, alerting the health department in terms of that being the case. Now, the other side is anyone who tests positive as part of the contact tracing mechanism. So let's say you test positive, you're going to get a call from a contact tracer who does an interview to find out where you work, where you've been, who else you may have come into contact with during a period where we think you may have been contagious, and that we identify those folks to be able to notify them as well as their potential risk and exposure. Now, certainly when we find out that information is used to do an effective contact investigation. And certainly if it is a large venue that is involved, such as a school or public setting where there's a large amount of other individuals who may have come into contact and be at risk, we would make that information public. And so on the flip side of that, what I would ask is, if you do have information or if individuals do have concerns about cases at a particular place, we ask that you notify our disease control team so that we can look into it and find out. One of our big concerns is we want to make sure that folks understand is when you see something or you hear something, let us say something, because that allows us to be able to, in the time window within which we may get that notification from the contact tracing team at the state level to the local level, the sooner we find out that information, the sooner we can implement and initiate an investigation so that we can be able to provide the necessary guidance that we provide from a public health expertise. So if there are folks who have information or concerns or are hearing these things in the community, we would implore you to call our disease control line at 240-777-1755 so that we can get that information as quickly as we can and put the necessary precautionary measures in place.
Thank you, Dr. Gales. Rebecca Tan with the Washington Post has a question for County Executive Elrich as well as Dr. Gales. Go ahead, Rebecca.
Thanks for this. I have two questions, one on testing and just a quick clarifying question on nursing homes. My first question is, I'm wondering if either Dr. Gales or County Executive Elrich, you can say specifically on what grounds the contract with AdvaGenix was terminated. And then, sort of related to that, whether there's the possibility of resuming a contract with them if they're given authorization by the state to continue testing. And then I have a clarifying question on nursing homes that I can say in a second. Or after you guys respond, sorry. To the first question, sorry.
Who wanted to go first? Mr. County Executive?
I feel a little bit uncomfortable talking about something that could wind up under litigation. I mean, assuming everything gets cured, then it's totally possible that we could renew or have a contract with AdvaGenix. We have no idea right now what the reasons were. We have yet to see a report. If that's at least the last I heard, is we had not received anything on the case and why the state took the action that it did, other than that it took the action. So we're a little bit waiting to see what the actual information is on this case.
I think it's also important to emphasize is that, the state ordered a cease and desist order and so that's what's in place. And so I think for further questions related to the content of the investigation, those questions should be referred to the State Maryland Department of Health because it is the investigation that was done was conducted on a federal level by the Centers for Medicare and Medicaid Services with the state, and we were not involved in that process.
I did want to give a member of the county attorney's office the ability to weigh in on this. Sylvia Kinch has joined us and she is unmuted. Go ahead, Sylvia.
Thank you. With regards to the AdvaGenix issue, I just wanted to note that the letter that was sent to AdvaGenix has been made public, so you can actually view that and see the reasons why we're moving for termination. But simply put, at this point in time, AdvaGenix is not able to comply with the terms of the contract because it's not able to provide the testing that we had agreed to.
And is there some place we can direct folks to that letter?
I will find a link and share it with you, Julie. Maybe you can give it to them.
Yep, thank you very much. And
got it. And yeah, just a quick clarifying question on nursing homes. My understanding is that the state has stopped providing testing for staff of nursing homes, but not for residents. I just want to make sure that that's your understanding as well.
Dr. Gales, do you have that information? He's unmuted. Hang on one sec.
Okay, I'm unmuted now. So we can go back and clarify, but the efforts that we're looking to support the local nursing homes would provide testing for the residents and the staff members.
Thank you both. Donna St. George with a post is also on the call with a question unclear for who. Go ahead, Donna. You still with us?
Give me two, hold on. Okay, she should be unmuted. Donna?
Yes. Can you hear me?
Go ahead. Yes.
Okay. I had a follow-up on the Bullis situation for Dr. Gales. You said that you were investigating, and I guess it's an outbreak because it's more than one case. Reportedly, the 2 staff members. Can you explain a little bit more about what that entails and if that means the school could possibly be shut down longer than the 2 days that it's supposed to be shut down? I also had a second question, if a real quick one, if I could.
Okay, thank you for the question, Donna. So there, to your question, we did, there was a report of a couple of staff members who tested positive. So part of our investigation process will be finding out and confirming the number of positive tests. Are they residents of our jurisdiction? Do they live in other jurisdictions? Investigating to see what types of activities they were involved in the school setting. Who were they around? How long were they around them? How close they were? And that type of information will help drive the determination to identify who are considered to be high-risk contacts, who would need to quarantine themselves and get follow-up testing, and to also identify to be taken. Is this a question of sanitizing a room, a school, a parking lot, versus, needing to take, higher scale action in terms of having a protracted close down. At this point, we don't have the full spectrum of information to answer those questions, but those are the types of things that would be involved in a contact investigation process. And now that we've been made aware of it, the team is actively investigating to find out that information to be able to provide the relevant and appropriate interventions that need to be put into place or taken into consideration as next steps.
Thank you. Thank you. And if I could, just a very quick follow up on a question from last week about childcare in MCPS schools. Could you weigh in just again, Dr. Gales, about why it's safe for childcare to operate, but not for schools to open? I think that question has come before parents a lot in the last week, and I just, if you had a chance to clarify, that would be helpful, I think.
So, to Ike's earlier question, this actually falls within the parameters of the lawsuit that's currently in place, and so that hampers my ability to answer that question in more depth. But what I will say is that, and this is language that in conversations with other health officers and folks at the state level, is that there is not a direct comparison, apples to apples, between the child care and school setting, and both in terms of the scale of operation and the types of operations and the types of interactions involved, due to length of duration and a host of other things. As well as one of the considerations is that childcare actually has not been shut down on a large scale in comparison to schools throughout the pandemic. And so there are more data points in terms of identifying some potential best practices that may be associated with that. And that could also potentially be leveraged and put into place when thinking about school instruction and in-person instruction. And so on the flip side, schools have been closed since the very early stages of the pandemic. And we don't, all of the different ideas and strategies that we're talking about implementing are strictly based upon what we think will work and our best guess. And unfortunately, the only examples or the best examples that we have for jurisdictions who've been able to successfully open up and sustain that are other countries. And, as part of our conversation when we met with the different schools is we talked about the different levels of transmission of the virus and daily caseloads in those countries that were able to successfully open without seeing a case of widespread outbreaks secondary to that.
Okay, thank you, Dr. Gales. Kevin Lewis with Channel 7 has an AdvaGenix question.
Yeah, first, before going to AdvaGenix, just Dr. Gales or County Executive Elrich regarding BAR-T and kids after hours. I guess the devil's advocate argument to that would be it was a experiment to keep daycare centers open throughout the pandemic, and someone's going to have to experiment to see what it's like opening schools with similar practices in place. How would you respond to someone's got to make that initial effort to open schools at some point in a capacity similar to BAR-T or kids after hours, even if it is with a limited population of students?
Well, I think the first thing is everyone should do some more background information in terms of BAR-T and other programs. I know that has been thrown out as in, from my understanding, BAR-T is one of over 20 different providers that have worked with school systems over a number of years. This is not something that fell from the sky and is a new contract and a new opportunity. That is my understanding. So I would encourage using that terminology to present the full picture related to that. And I will say this, as a health officer, as a clinician, a medical provider, I've taken an oath to do no harm as best as possible. And I don't like the notion that we are any type of public health procedure that's looked at a policy. I feel very uncomfortable couching it as an experiment. And so what we're trying to do is to not put kids as an experiment or teachers or staff or family members as an experiment, which is why we're trying to use the scientific data as best as possible that recommends and suggests is that if we achieve a lower level of community transmission and lower caseloads, that decreases the likelihood that individuals will arrive at a school presenting with COVID-19 that could potentially introduce that within the network of transmission. And so our task is to continue to explore best practices and to look at the guidance that is available to use those parameters to guide our decisions. And so we don't, it's to say that someone has to do an experiment or someone has to put that forward. That's not language that's consistent with the execution of public health principles that we do as a county. And I would venture to say overwhelmingly across the board in my health officer colleagues in other jurisdictions.
How would you describe then the putting forth of childcare throughout this pandemic, if not an experiment?
I think part of it's necessity. I mean, the first opening of childcare was for first responders. And you can't not have first responders. And they can't bring their kids with them. They can't leave their kids home alone. And so there was some urgency to dealing with that issue. And I don't think it was an experiment. I mean, people worked under pretty tight rules in terms of how many kids could be in a classroom, who the adults could be. They were very careful about what they did. And I think the result was they were able to manage that, and probably having the experience of managing that with very small groups. And you got to remember, nobody was filling up school buildings with this. So it was very small groups and very limited settings is way different than proposing that you let school buildings open up and fill them back up with kids. So I think it was a different circumstance that triggered the necessity to come up with a solution. The state did its best to provide a solution to the problem. We did our role in making sure these places were as safe as possible, and there was a lot of thought that went into it. In contrast, nobody brought their school opening plans to the county and said, hey, are you okay with these plans? Here we are 2 weeks later, and we've got 2 plans that were actually brought to us by an institution, and I think the other 2 were brought to us by parents. So it's a way different approach of a very professional, what do we do to make this safe approach versus you guys are all on your own, do what you want to do. That's not the way to do this. And we would much prefer to be engaged in having meaningful discussions and frankly, the ability to say no to some things just to ensure that things are done safely, as opposed to just be a rubber stamp.
We've got a bunch of reporters still stacked up. So Kevin, if you still have the other question, just put it into the chat. I'm going to go to Caitlynn with Bethesda Beat, who has not yet asked a question. She's got one for Dr. Gales.
Hi, good afternoon. Going a little bit further into the conversation about non-public schools again, just to ask this very directly, the first part of my question, you said that there is an expectation that institutions, including non-public schools, would report coronavirus exposures. Just to be clear, is it a requirement? And if so, what are the repercussions for not doing that? And then the second part of my question, just broadening the conversation a little bit, have any non-public schools reported COVID exposures to you?
So it is a requirement in terms of reporting. We all have a requirement of reporting communicable diseases and reportable diseases to the health department, as outlined by COMOR. And so to date, we have not received any formal notification from any of the non-public schools of any type of outbreak or COVID cases in their settings.
Okay, Briana with Bethesda Beat, also with a question for Dr. Gales.
Yes, thank you. I have a question regarding AdvaGenix testing. So first part of my question, AdvaGenix has said the test results are fine and not an issue, but I know last week the county recommended that those tested with an AdvaGenix test in the last 2 weeks at the time should consider being retested. Could you address if there's a concern about the results? And second part of my question, we were given information by the county that the county has not paid or received any invoices from the company. Do you anticipate receiving any invoices for the work already done by AdvaGenix, or do you expect the county will not pay for the testing that has been done because of the issues in question?
I'll speak to the first part because I'm a public health person. I'm not a contracts person. But what I will say this related to the information related to the test, in an abundance of caution, we put that recommendation out. I think, again, in order to find out more specifics about what the state and the federal government found, they would be able to answer those questions in more detail. But, you know, when we received that guidance from the state or we saw the order from the state, that's the action we took. But to further answer that question in more detail, to make any comment on that, I would recommend you contact the state or the Centers for Medicare and Medicaid Services for more information related to the report.
Okay, we've still got several reporters.
I'm sorry, did I get my second question answered on the?
Oh, sorry, Brant. Yep, go ahead.
Say it again.
It was related to the contract itself.
I can repeat it again. We were given information by the county that the county has not paid or received any invoices from AdvaGenix. Do you anticipate receiving any invoices for work already done, or do you expect the county will not pay for the testing that has been done because of the issues that have been raised by the state?
So I'm not a contracts person or a lawyer.
We have a
lawyer available.
Yeah, I'm happy to respond to that. What I would say is we will wait to see what AdvaGenix provides us. We'll review it and then we'll make a determination.
Okay, got your questions in there, Briana. Jack Moore with WTOP is on the line.
Okay, question. It's kind of on AdvaGenix, but I think it's been answered somewhat. But AdvaGenix sent a letter to the Montgomery County Council just a few moments ago, revealing that the Maryland State Health Secretary order has been revised and that they actually did not lose their license. Their license hasn't been suspended, although they don't have authorization to perform the test. I'm just wondering if you've seen that letter and if that changes the decision making. And then more broadly, you know, the health order from the state says that all tests that AdvaGenix did are erroneous or questionable. And I'm just wondering, is it concerning, Dr. Gales, from a health perspective, you're the health expert, that that seems like such a severe statement, and we don't know what the issue is, and we can't really get anyone to say what is the actual issue with the test.
Well, we've been on this call actually, so I'm not aware of the letter that was sent from the company to the county council. As always, we will do our due diligence in following up with that and finding out more information. So unfortunately, I can't comment on that. But as it relates to your comment related to the test issue, is that is, with there being uncertainty, that is why we took the step to provide the guidance that we did, in terms of saying, if you within that 2-week window, you should consider getting retested. We don't have, the reason why we can't comment on what issues may be brought up with the test is because we don't have a copy of a report. We don't have the definitive findings, and so that's why we're cautious in terms of saying, I can't tell you definitively there was an issue with A, B, and C that caused the concern. What we're merely going off of what has been shared with us in terms of knowing that there was an investigation and the order that was put into place by the Secretary of Health, and consistent with the legal team's comments, is that that's what we have to follow in terms of the ability to be able to execute the contract and provide the testing that we need.
Okay. Did we get to all of Jack's questions? I think the best that we could. We've got several follow-ups, and we are approaching almost like an hour. So here's who I have right now. Ike and Kate Ryan will be available for follow-ups, but right now, Randi Bass with WDVM, I don't believe has gone yet. So we will go Randi, Ike, Kate, and Kevin, and that is it. And if you guys could keep your questions as tight as you can, please. Thank you.
Good afternoon, everyone, and thanks for taking my question. Dr. Gales, if there is a large outbreak at a non-public school or childcare operation, and that school or childcare center isn't taking action or closing voluntarily, is the county in a position to take emergency action and step in, or even shut things down or issue citations, as has been done with other businesses?
Yes, and I'll be perfectly honest. We will take whatever necessary action we need to take from a public health perspective to mitigate further transmission and public health risk, as allowed through the state regulations and state laws that are in place.
Okay, Randi, all set. Ike, back to you for a follow-up question.
Okay, let me make this real quick. I know you said that it's a requirement for private schools to report COVID-19 cases to county officials. I know you said that you have yet to receive any notification. Real quick, when the school starts in about a week or so, when these schools start to report to you, will that information be made immediately public for us to see? And also a follow-up question to what you just asked. You said that you will take whatever necessary action needed from a public health perspective. To what extent does that action actually go to? What does those actions actually look like when you're seeing that some of these schools are having an outbreak and they're not doing what they're necessarily needing to do? What does that actually look like?
Well, I think to your first question, actually, could you repeat the first part? I lost a little bit.
The part was, I just asked that you said that it's a requirement for private schools and religious schools to report COVID-19 cases to county officials. And I know you haven't received any of that. When the school starts, and let's say those reports start coming in, will those reports be made available to the public for us to see? And if so, how long will that take?
Sure. So the process we take is the first priority is to make sure that we have as much information as we can, and any of the individuals who are directly impacted, whether they are index cases or individuals who are identified to be high-risk contacts, our first priority is to make sure those folks are notified, they've been identified and notified and provided the appropriate guidance. Now, again, moving forward from that, after that's the big priority. Now, if it's relevant and germane to public, particularly given a large school setting where there could be a large number of folks influenced and who may also have come into contact, I reference back to way back to March, actually, with one of our first cases one of our first 3 cases had attended an event at a nursing home facility. And we did, we put out a press release to say, we had a person who tested positive who was here during this time period. If you were there, you are at potential risk and you need to give us a call. So we would leverage, that public notification to be able to support the contact tracing process, to be able to notify the public, particularly those who are at potential risk of exposure.
Okay.
And then in terms of the steps that we would take, I think it depends on the situation. It depends on the scope of a potential outbreak, as well as the number of people who may be at risk based upon the exposure at hand.
Okay, Kate Ryan.
There we go. Hi, I just want to clarify on the Bullis situation and revisit some of the private daycares in the public schools. On Bullis, are you confirming that 2 staff members did indeed test positive? Is that right?
At this point, I'm not confirming. What I'm saying is we've been made aware that there have been a number of potential exposure there. And our team is investigating and finding out all of the facts. And once we have more of a handle on that, since we were just made aware of it very recently, we'll be able to release or comment further in public.
Okay. And then in terms of, and again, I'm not picking on Barty, I'm just using them as an example because I'm familiar with them. They are going to operate from 7:30 to 3:30. That's an all-day situation. And again, I keep hearing from parents, I think other reporters have suggested this as well. Well, wait a minute, why can they do that if I can't? Because even if it's a question of scale, and I understand your point there, the issue is with the building and a group of students. How do you make sure that the school buildings are safe and you don't have problems with ventilation, for example, and that there's no crossing of programs? Like, is every school only going to have one particular program, or will different groups be allowed to operate out of one school? And what about fears of kids from different pods, if you will, crossing, having contact?
I think literally gets to the point that we had concerns about with schools, is that it's not necessarily an individual classroom setting that is the primary concern, or certainly not the only concern. It's the constellation of other things: hallways, restrooms, water fountains, HVAC systems, as you've alluded to. And that's why we're working with MCPS to identify, it may be more than one in a particular school, but it's not going to be 10 or 15 or 20 like you would have in a number of classrooms in a school setting. And so we're going to work and identify how those separations, separate entrances, separate exits, separate hallways, physical barriers, separate restrooms, all those things can be done for a childcare setting. And as I think I alluded to before, we're looking at other spaces where we can expand to childcare that would have those single units in them as well that are non-school based for that exact reason. It is inappropriate for us to try and replicate a school setting with childcare options that are as expansive as the school would have been in the first place. That would be totally against the premise and principle for which we acted with schools in the first place. And so it is, scale matters a lot. I would also note that there are child care guidelines issued by the state. There are not school guidelines issued by the state. Mm-hmm. And clearly they draw the distinction between those two. Otherwise, they would just say schools use the child care guidelines as well. And so that distinction exists across federal, state, and local guidelines. And therefore, we draw the same distinction.
Our news briefings normally go 45 minutes. We are approaching an hour today with a lot of reporter involvement. We are going to close this briefing with Kevin Lewis getting the last word, I believe, regarding the AdvaGenix contract.
Yeah, so just with regard to AdvaGenix, when the press release first went out in late May, the county and AdvaGenix had committed to doing a minimum of 20,000 tests per week, I think starting on June 8th, which would be more than 200,000 tests thus far into the summer. Obviously, that wasn't achieved. It was somewhere between 17 and 20,000 total when the contract was suspended last week. Why was the county not able to hit that 20,000 per week threshold that I think everyone thought would be in the cards. And I should say, to follow up on that, is it on the hook to pay for 200,000 plus tests that it didn't deliver to AdvaGenix?
Dr. Gales, are you able to answer that? And we've got our attorney's microphone available as well.
Well, the first part, as you know, and you've been present on our briefings since May, and we've talked about the challenges that we encountered in terms of launching and expanding our testing platform that involved the self-collection mechanisms. Yes, that was our goal, but yes, we did encounter some issues in terms of scaling up, many of which we've talked about on our numerous briefings since May that you've been a part of. And so I think with any type of new platform or testing platform, you have to build infrastructure to be able to sustain that. And I'm actually quite happy. What's helping us continue to move forward in terms of introducing new testing technology is that we've taken the time to build out that infrastructure. That infrastructure includes having a network of places to be able to test, expanding the spaces where we have available already, introducing other types of platforms. As you know, we've introduced mobile testing components through Ready Responders, as well as our volunteers from Project Hope and other spaces that are able to do on-site testing on-site at residences, as well as shelter communities, as well as the technology components in terms of making sure that we have addressed the logistical issues around notification of results, creating a scheduling system and a registration system. So if you look across the last few months, we've grown that infrastructure and built that infrastructure, and that's the same infrastructure that we will continue to leverage as we do a temporary reboot and we resume our high throughput self-collection mechanisms throughout the county.
Anything from our attorney?
Yes, regarding the payment question, as we've indicated previously, as of yet, we have not received any invoice from AdvaGenix. When we receive it, we will review it and then decide how we're proceeding from there.
And that will be our last word on this Wednesday afternoon. Thank you so much for joining us, everyone, and we'll see you here again next week. Once again, this entire briefing will be placed on our Facebook and Twitter. Thank you so much. Take care.
Thank you.